Aloha and welcome to Kokua Council's annual community forum regarding legislative priorities. We're looking forward to the 2023 year, and we have with us some of our community affiliates. I'd like to get into these measures and proposals because they are very important. And after each measure or proposal is offered, I'd like to allow a couple of minutes, maybe 3 minutes for questions and responses, and then we'll go on to the next measure. So Sam, you'll start for your group, please. Introduce yourself, your group, and your measure.
Mahalo for having us. My name is Samantha Trad. I'm with Compassion and Choices. I'm joined here with Aubrey Hawk, who's on the Big Island, and Sarah Mance, who's our Hawaii State Manager. And we are bringing forth a bill that we brought last year. In fact, the bill made it all the way through. It was supposed to go to the governor, and then it ended up dying behind the scenes. And we've heard the reason why it didn't make it to the governor's desk was it really didn't have to do with the substance of the bill, that it was just politics, unfortunately. But it was really devastating. So what the bill is it's a very necessary improvements to Hawaii's Our Care, Our Choice Act. In 2018, the legislature passed a law for terminally ill people to be able to access a medication, an aid in dying medication, so that they can peacefully end their suffering. Since the law passed, for those who can access it, it works well. We have reports from the Department of Health that show that those who can access it are really grateful to be able to have this end of life option. However, a lot of people are not able to access it, especially on the neighbor islands, but even in Honolulu, it can be difficult to access it. And there's a number of reasons for this. The number one reason is there's a mandatory minimum waiting period of 20 days. Now, most people who are terminally ill don't ask for medical aid in dying until they need it because they have no idea that there's a 20-day waiting period. People who choose aid in dying want to live. They don't want to die. Hawaii is the only state with 20 days waiting period. Other states that have medical aid in dying laws either have a 15-day waiting period, which is also problematic, or many states are turning to a 2-day waiting period. So in New Mexico and California, they have a 2-day waiting period. And in Oregon, you can actually waive the waiting period entirely. The physician who writes the prescription can, if the patient's unlikely to survive the waiting period. We think this is absolutely necessary. And a person will still have to go through a 17-step process to access the law. So it will still take time to access it, but having that artificial 20 days, we've heard reports from Hawaii Pacific Health, from Kaiser Hawaii, that about 30% of people who are dying who want this option die in exactly the way they don't want during that waiting period. So we really want to tackle the waiting period this legislative session. And advanced practice registered nurses actually already have within their scope of practice the ability to do everything that a doctor does to support patients in aid in dying. And so the other part of the bill is that it will allow APRNs to work within their scope under the Our Care, Our Choice Act. And there's actually 3 different providers that a patient has to see and consult with in order to access the law. So this would be huge. You know, right now, a patient has to find 2 different doctors, as well as a psychologist or psychiatrist or social worker for the mandatory mental health component. And as you know, it can be so hard to have a doctor's visit, to find a doctor, let alone a doctor who can support you in this. And so we have support from the nursing groups to continue including them into the bill. So that's what the bill would do to improve the law. And we think it's really important. Aubrey can tell you, she gets calls all the time from people who are dying, from people whose loved ones are dying. They're watching their loved ones suffer and they cannot access the law. And we believe that these improvements, which are actually recommended by the Department of Health, will help these dying patients be able to access the law. Do you want to add anything, Aubrey?
You know, just what you said, Sam, so for the group, one of my roles, in addition to, you know, just working on getting the bill passed, is as a volunteer patient navigator. And so I am the person that some patients will somehow find and call when they're not getting anywhere with their own care team. And often these are patients on the neighbor islands. Again, I'm on the Big Island. I'm actually heading to Maui today. Same situation where we have a lot of rural patients who are not served by Kaiser or by Hawaii Pacific Health hospitals. And they are getting nowhere when they're trying to access this law. That is our state's law of the land. So I hear just horror stories of people, who are spending their final weeks and months when they should be enjoying their last days, running around from doctor to doctor and making phone calls and trying to find help. And it's very stressful. And we are often able to help them, but it takes additional weeks and lots of phone calls and lots of work. And so we do really want to be able to amend this law so that access is fair and equitable for everyone, no matter which healthcare system you use, no matter which island you live on.
Thank you, Aubrey. Are there any questions about the bill?
Doug
Yes.
has his hand up.
I have a question about the implementation of this. Is there a way that you can apply for this like in advance when you think it might be necessary, and then have the ability to cancel it if you have second thoughts?
That's a great question. And we encourage everybody to talk to your doctors as soon as possible. Have that conversation. I'm not sick, and I've had that conversation with my doctor because I just want to make sure that I will be supported if the worst thing happens, I become terminally ill, I qualify for the law. However, you cannot actually start the process until you're eligible. And like I said, it's 17 steps. The main components of eligibility is you have to be terminally ill with 6 months or less to live. You need to be mentally capable of making medical decisions. So this is not something you would put in your advanced healthcare directive, because you have to ask multiple times for the medication. You also have to be able to ingest the medication yourself. So this is not euthanasia. It's taken on your own. So I encourage everybody listening today, if this is something you think there's 1% chance you may want in the future, have a very direct conversation with your doctor. Although
Let me add,
there's a lot of doctors who have nurse practitioners as doctors, and they can't help, Yeah, Aubrey.
I think Doug was also asking about, can you get started early and then maybe cancel it if you change your mind?
Oh,
yes, of course. The moment that you have a 6-month prognosis, you can get started and start asking your doctor. And like Sam said, even prior to that, you should know that your care team may be willing to support you if that ever comes up. But no matter, you can go through the whole process. You can even have the prescription medication in hand. You're never obligated to take it. You can stop the process at any time. It is completely all self-voluntary, self-directed. And so there's never any obligation.
Yeah. Thank you, Aubrey. And I'm just going to throw in there, because we have data from all the states that have authorized aid in dying, and it's the same data point in all the states that about 25 to 30% of people who go through the whole process and get their aid in dying medication, they never take it. They never take the medication, because you can always change your mind. And they all report that just having it gives them a huge sense of relief to know it's there. Sometimes they even talk about they improve, their symptoms improve because they're so relieved they have this option, so they don't have to suffer. Yeah, Rick.
I was going to say just that. So the peace of mind of actually having the process completing and having the meds is huge for a lot of folks. The thing I was going to say is during COVID, we lost 750 medical providers here in Hawaii. So we have a huge shortage. And then the other thing working with you guys I've discovered is there's a number of docs that will not support this. And so what Sam is saying is really, really important. I have to have that conversation with my doc, not just, I'm doing something with compassion and choice, and I'm thinking this is what I'm going to do. It's going to be, when I get there, will you do it? Because my doc is affiliated with Queens, and Queens does not support this. Is that correct, you guys?
That's actually not correct, Rick.
Okay.
So Queens allows their doctors to practice if they want. The problem, though, is they don't have an internal referral process. So if your doctor at Queens doesn't support you and they don't refer you to another doctor, then you call us usually, hopefully, if you know to call us, right?
Okay,
Both Kaiser and Hawaii Pacific Health, the moment you ask for aid in dying, their clinicians have been trained that if they don't feel comfortable supporting the patient, which is totally fine, they refer the patient to a navigator who helps them find a doctor who will support them.
and let me ask that, and I'll let it go at that. The mental health piece, how hard is it to find someone that can do this assessment here in Hawaii?
It depends where you get your health care. If you're at Kaiser, they help you connect the dots.
Yeah.
Same with Hawaii Pacific Health. But if you're somewhere else, it can be more challenging. So the Hawaii Psychological Association has really been phenomenal. They're really good at helping people. Hawaii is the only state that mandates the third mental health assessment, but it's not a big enough barrier that we even want to try to change it in the law right now. These other two amendments, we really, really, really want to get through. Yeah, Doug.
Thank you.
Oh, or I don't know who had their hand up first. I'm sorry.
I did, thank you.
Yeah.
Okay, my question is this, you said it was politics. What do you mean by that?
What I mean is, this bill, we've been trying to pass this bill since 2020, because again, it was recommended by the Department of Health. The Department of Health is saying these are really technical changes that need to be made so people can access the lots, just cleaning up the bill. And the chairs, it went through every single house, and the substantial amendments were unchanged. Everybody agreed this was a good bill. We did our homework, made it to the very end. And I have talked to so many legislators trying to figure out what the heck happened, and nobody really knows, other than, I don't know if it was something behind the scenes, but it didn't have to do with the substance of the bill. We have all these legislators on record supporting the bill. So I'm very hopeful. We've been talking to legislators again this year, and it sounds like, because we even asked, like, do we need to change the bill? What do we do? Because we need to get something through. People shouldn't be suffering any longer. And they've said, no, keep the bill as it is, have it go through again. And by the way, I've talked to Josh Green, and he said he will absolutely sign the bill, get it to his desk, he will sign it. So that's good news. So we would be grateful to have the endorsement, have this be a priority bill. It should be a shoe in the door. We've talked to so many legislators about it. There is the support. It should go through. Josh said he would sign it. It's just, one more time for those in the back, I guess.
Doug, go ahead.
Yeah, short question. I have a friend who had a friend, and I don't know if this friend of a friend was a Hawaii person or not, but she had a terminal diagnosis, and since what you are talking about isn't available, she and a bunch of friends went to Switzerland, and they had a kind of a farewell ceremony, and and did it there. So my question is, do you know of any people here during the interim before your bill passes that could help arrange such a thing? You would have to have funding of, pretty substantial funding to do it.
So it is possible to access the Our Care, Our Choice Act. There have been about, I believe, 80 people over the years who have accessed the law. But it is a very conservative law compared to Switzerland, and we are not trying to do what Switzerland does. We're really, this law it's been around actually for over 25 years. It's modeled after Oregon's law. It's been around since Oregon passed 25 years ago. So there are doctors for sure who will do this. And we've had summits with the doctors. We're constantly getting input from the doctors on the ground, the nurses. The Hawaii Department of Health has had a few summits where we've all come together to talk about what's working. And all the doctors are saying the same thing. Shorten the waiting period. Have APRNs do this. Everything else, we'll keep the 17 steps, but we need to make these changes so people can access the law. So if you know anyone who's terminally ill or who might be interested in this, talk to your doctor. If they can't find a doctor to support them, have them call Aubrey, and maybe Aubrey can put her number in the chat. We would love Aubrey to retire one day if we can amend this bill so she doesn't have to do this she really does it as volunteer work. She gets so many calls from people. And people shouldn't have to know to call Aubrey to be able to access the law. It should be equitable. Anybody who's dying who qualifies should be able to access it.
All right, there's one more question, and that will be the last question for this topic. Maddie?
Hi, I'm just wondering, for the use of the APRNs, can all three providers be APRNs?
Right now, the way the bill that made it all the way through last year, that is how it was written. It would almost never actually happen that way, since most APRNs work with a doctor, and that's certainly an amendment we would be open to. But the way it's currently written, yes, they could be, as long as they're qualified for each of the different, the prescribing, the consulting doctor, as well as the mental health specialist.
And are these face-to-face visits? Can it be telehealth?
It can be telehealth,
Okay,
as long as the relationship is already established.
okay. Thanks.
All
Yeah,
right,
great
thank you very
question.
much.
Thank you so much. Mahalo, everyone.
Thank you. All right, Kathy, you're next. Oh, you're muted too.
Okay, how's that? Okay, well, a lot of our priorities are things that have already been mentioned. The Hawaii Retirement Savings Program, affordable housing, of course. But a couple of new things we want to, we're prioritizing additional funding for kupuna caregivers, even though it's in the base budget. Inclusion in the governor's budget and funding for SHIP. Inclusion in the governor's budget for Healthy Aging Partnership Program. Workforce development, and that's all over the place. Everybody's on that bandwagon. And then increasing Medicaid funding and standardization of Medicaid coding and reimbursement, since that's all over the place. There's no standardization, and it's inequitable on many levels. And then paid family leave for family caregivers. So I really don't have any meat to that presentation, but if there's any questions about those priorities, feel free to ask.
All right, so Kathy, you're bringing these up to the legislature then, or your group?
I'm sorry?
So your group will be bringing these up to the legislature then?
Yes, well, in partnership with the legislative committee from Pabia. But yeah, I think we're all on the same page with this stuff.
Okay, I'm sorry, I didn't hear you. So in conjunction with Pabia and what other group?
No, we're all with Pabia. I mean, the priorities are similar to those of Pabia. So yes, we will be promoting those with the legislature.
Okay, thank you very much. Any questions for Kathy? All right, so Audrey, what you had to say, would you like to repeat it? I know that much of what you had said is similar to Kathy's. Audrey Suga-Nakagawa?
Yes, hi everyone. Yeah, I didn't realize how you were starting off at the beginning. Yeah, so we're not introducing any very specific bills, but we will be supporting bills leading in the area of affordable housing, especially for seniors as well as workforce. And then of course, in long-term care, respite programs like what Kathy had mentioned, funding for nursing homes and home and community-based programs. Those are the kind of bills that we will be supporting. And then of course, prescription drugs. So if there's anything that's introduced related to prescription drugs that would complement the efforts that was just initiated by Congress with Medicare negotiation on lowering the cost of prescription drugs, it will be something that will be also high on priority for AARP. That's basically, those are the big areas. Any bills related to the kupuna caregiver bills, of course, we're funding for that. And you know, we will be looking out also for broadband, digital inclusion bills that will again increase the access for seniors who are trying to, you know, become more digital literate. So that's it for AARP.
So what I heard from Kathy and you, Audrey, is that there's a lot of things that need money. How are we in terms of funding on these?
Yeah, probably. So for example, for the affordable housing, I would imagine if there's any additional funding that will go into the revolving fund, the revolving trust funds, that would be something that we would be supporting. Long-term care funding, if DHS is seeking for additional funding to increase the state match, to get, you know, to draw down the federal dollars, you know, we would support that as well.
Okay, and then you brought up, I'm so sorry. maybe it was Kathy who brought up the kupuna caregivers. What's the status on that?
Do we know, Kathy, if if EOA is or PBIA is in? I think because it's a new fiscal year, wouldn't the funding be put into the administration's budget? Are
Well,
they?
Yeah, there's already money in the budget for the Kupuna Care program. Now that they've combined the Kupuna Caregiver program, I think that the priorities would be making sure we have enough funding, if not getting additional funds. So I really don't know where we are with that yet, but I think because it's on our list of things, our priorities, that we are looking for more funding.
All right, thank you very much. I see in the chat that Nanea, did she leave? Nanea, are you still here? No, I guess she had to leave. All right, we're just kind of going around, well, around my screen anyway. Ron, welcome. Ron from Alzheimer's Association, thank you very much.
Yeah, Lila. Sorry. Yeah, thank you for the opportunity. Would it be okay if I share my screen, Lila? I'm sorry, I have a quick set of slides that I can share with everyone. If you could give me a minute. Let's see. Current slide. All right. I think everyone should. Are you seeing my presenter view or the other? I'm sorry, Lila, you are muted.
Looks like a work page kind of thing, Ron.
Okay. How's about that?
Yeah, that
Yeah.
one's good. That's good.
Thanks, Rick. And for those of you, I see some familiar faces on the call. Please bear with me. I've already shared these priorities with you. But just two quick priorities. Again, thank you for the opportunity to share these with you and gain your support. So I should preface this conversation by saying these priorities are not new. They've either been successful in the past or failed as of recent, but we're bringing them up for your consideration. And then also, they don't necessarily need legislative intervention at this time. From now until the session comes around, things may change. However, they are currently on our list of legislative priorities for this upcoming session until those things happen. Okay, so our first goal is with respect to the dementia coordinator position. So as you can see there, our ask is to appropriate funds for a permanent full-time dementia coordinator position. And some of you, or many of you, are already familiar with this role. It's housed within the Executive Office on Aging. Just a little background and history on this position. It was actually established in law back in 2013. So the actual coordinator role was placed into law and acted as such with an appropriation amount back then. And then subsequent years, there have been requests for appropriations leading up to 2014, 2015, 16, 17. There were some other requests in the meantime, such as in 2016 to remove reference to the position being appointed by the director, which is currently still stands, that it is an appointed position by the director of the Executive Office on Aging. In 2019, there was an appropriation made and enacted as such in that amount of $59,000, in addition to exempting the position from civil service and collective bargaining. 2020, there were appropriations requests again made, however, unsuccessful. And then as of recent, 2021 is where we had significant progress where the position was funded or requested by through the agency to the administration. So it's now embedded into the base budget for at least for fiscal years 22 and 23. So I will say that current status of the role is that it is unfilled. Again, this role would be the champion within the agency to carry out the strategies contained within the Alzheimer's dementia related state plan. And that plan has been in place since 2013. So, with a vacant position, we need to ensure that it gets filled. Latest update that I have, and I want to be transparent with you all, latest communication that we had received was that this position is currently expected to be posted, if not last week, which didn't occur this week. So we're very hopeful that it will be posted as such and filled by end of year. However, again, it's still a priority of ours given the uncertainty of that. So, posting as well as hiring and all that. We'll definitely keep everyone posted as progress is made. So that's the first proposal that we have. Any questions, feedback, thoughts?
I have one real quick. So we were told in Pabia that by Caroline that they were posting the position, I think this week, yeah, for 5 days. Is that correct, Ron?
Yes, that is correct. It should be up. We're hopeful that it'll be up this week, right?
Yeah, that's what
And
they
then
were
this
saying.
will- Yeah.
Okay. Thanks.
All right, so our second proposal here is with respect to public health campaigns. It's pretty straightforward. This request, again, it's asking for funding to fund the campaign primarily around the preventative aspects of the disease, early signs of cognitive impairment, early detection, diagnosis, and ultimately consulting with your medical physician. So really catching this early on. And the importance and significance of this, in addition to prevention, is also there are drugs that are rapidly coming up on the market to slow the progression of the disease. So it's very important as folks are experiencing symptoms, they're seeing these impairments, that they consult with their physician. My understanding is that as early as next month, December, and even January, there will be drugs, or hopefully that the drugs will be FDA fully approved. So it's important, right, to catch things early on. Just a little background and history on this one. In 2016, there was an appropriation request made in the amount of $200K, which are unsuccessful. And just to note as well, there's never been a public health campaign focused on Alzheimer's and dementia. So definitely appropriate time given, our aging kupuna population here in Hawaii, but also with the rapid approvals, or I'm sorry, the fully approved drugs coming on the market. And that is pretty much it. Any questions?
So I have a question.
Sure.
Again, issues always funding. Where's the position? What is the position on that at this time?
Sorry, Lila, can you please repeat?
Sure. So I noticed 200,000 was asked a few years ago. And is that what you're still pursuing? 200,000?
So yeah, thanks, Lila. We're still kind of ironing out the details, but we're looking at 500,000. I think to run an effective campaign, that is definitely, the direction at minimum we'd like to request. I will say that the federal government has a building our largest dementia infrastructure grant as well, that is scheduled to be granted in Q1 of next year. So that BOLD grant can be coupled with, state funds as well. So, resulting in a much more effective campaign. So looking forward to that. And I see Diane posted the position online. That is wonderful to hear. Great. So yeah, if you have any interest or know of someone who is interested in the role, please let us know, and we'll direct you over to the EOA.
Thank you very much, Ron.
You're
All
welcome.
right. Next presentation is Rick Tabor and Robert. I'm so sorry, I can't pronounce your name.
Tousignant.
Thank you.
Mr. T.
Mr. T, that'll work.
Yeah, so thank you, Lila, and thanks everyone. Good turnout here. Robert is actually with Miracle Ear, so he's an owner operator, does assessments, and he's been kind of a key person to help me along this road here with hearing aids, which I started trying to help with 5 years ago. As you know, we had a bill that has died officially. It's run its 2-year course, and we're back to square one with a lot of knowledge though. There was a sunshine review that was that the last year at the end of the session, it made it all the way to the end, just like Compassionate Choices, Our Care, Our Choice. And then all of a sudden at the final 5 minutes, it got referred for a sunshine review at the end. Les Condo was very clear, he would prefer it to be at the beginning. So what we're facing is, so with Pabia, I'm working with them, and then Senator Moriwaki, I guess, kind of appointed me to work on hearing aids. And I'm only working on hearing aids with a lot of support and help from others. So with a lot of input is where I'm at here. In the last legislative PABIA committee session, we didn't have enough folks for a quorum. So I literally spent 40 minutes on this, and I've put a lot of thought into a lot of the questions that were asked. So let me just launch into this, and then I'll have Rob kind of fill in. It's probably going to be more than one bill, and it might not even be a bill this year. I just want to put it out here and really open it to discussion. I know all of you, so we're just looking for feedback to try to sort out what direction we want to go and when we want to go there. Rob has some great ideas, so I'll have him share those from the professional level as to what he sees out there. So first off, 1 in 3 people between the ages 65 and 74 experience hearing loss. From ages 75 and up, that actually doubles. It's half of the folks that have hearing issues. So for our kupuna reasons, it's huge. Children, though, about 2 of 3 of every 1,000 children in the United States are born with detectable level of hearing loss in both ears. More than 90% of deaf children are born to hearing parents. So it's not that if you have a hearing loss that your child's going to have a hearing loss. It's actually the other way around. I actually work with folks who the parents had hearing loss and the kids did not. So the kids ended up having to care for the parents in those areas. So a new national study, this is fairly recent, has revealed that there's a wide gap in the use of hearing aids among Americans aged 55 and older, divided largely between race, education, and income. A little more than 1/3 of the adults with self-reported hearing loss are using hearing aids, the study found. This is the AARP had published this, and I can send the article to you if you're interested. I kept it here. High cost is the main, oh, Aubrey's coming back. High cost is the main obstacle, according to the research from the University of Michigan, which was published in the Journal of Gerontologists. Nearly half of the hearing impaired Americans with incomes in the top 25% use hearing aids, but only 1/4 of those in the bottom 25% did as well. So, so then I'll just go into there's with hearing loss. My concern has always been, and I think all of ours has been, the isolation and the loneliness. But it's worse than that. It's an atrophy that kind of takes over the brain. So there's an increase in dementia, mental and physical health issues that happens if someone has a hearing loss. And that's actually according to a 2020 Lancet Commission report that lists hearing loss as one of the top risks for dementia. Hearing loss can also make the brain work a lot harder, forcing a strain in the hearing and causing issues within the body. So the reasons that we really want to do something about this hearing aid situation is it's really devastating. It's costly, not just to the individual, their families, their employment situation, and the medical field as well. So it's kind of huge. So on the average, hearing aids can go all the way up to, is 10,000 kind of the top per ear, Rob, or is it?
So legitimately around 15 is kind of industry, the high.
Okay.
Yeah. So, but yeah.
So you can see cost could be a real factor. So last year we supported a bill. It was SB 2439, asking the state to cover hearing aids at $1,500 per ear every 36 months. And like I said, that bill ran its course and is no longer active. We recently had discussions, after much discussion, Legislator Kupuna Caucus decided to hold off with the state auditor's sunshine review. Didn't make sense to review a bill that we weren't sure we were going to continue to support. So where we've left it is if should we come up with another bill, Les would like us, the state auditor would like us to refer it right at the beginning. So he can review it then and give us the feedback that needs to kind of carry on. So here's a great, as of October 17th, across the United States, over-the-counter hearing aids have been approved by the FDA and are supposed to be supposedly available. Rob, I called CVS and Long's Drugs and I talked to the manager. They see no hide, no hair of any hearing aids so far, just batteries, and doesn't even know if they're on order through Long's Drugs. So that's just one call. But just Googling it and trying to find out if hearing aids are here on the island. Maybe somebody knows if they are. Doesn't seem to be. But the concern is that professionals have is that over-the-counter hearing aids can just be bought. Anybody can go buy one. It's for mild to moderate, they say. So it's up to you if you have mild to moderate, because you're not going to be assessed apparently. So without an assessment, you can go buy a hearing aid. Stick it in your ear, not going to be fitted, and just randomly see if it works. Now we have real concerns, about how that's going to work and potential damage that could go on. So there could be a bill around that. So in a recent last PAPIA legislative session, Derek Ariyoshi from County Executive for Elderly Affairs Division kind of came out of the meeting with that. It seems like education would be a real key thing to do, and offered that his office would probably be willing to do that. That might be a bill to do education around over-the-counter hearing aids. So that's a possibility. Just throwing that out there. Rob joined HMSA and Kaiser in a recent legislative. Was that September's? I think it was September's.
Yes, sir.
Kupuna caucus, legislative Kupuna caucus. HMSA is always going to say, and they always have, that hearing aids are covered. When I had HMSA, when I was working in home care, it was, you just need to talk to your employer about paying for the insurance that will cover that. Well, guess what? A lot of employers can't afford that coverage, and a lot of employees. These guys, our caregivers were making $13 to $15 an hour. They certainly couldn't afford to pay for the additional coverage as well. But that is true. So people will say it's covered. Kaiser does offer a hearing aid plan, and so they do have a program for that. And Medicaid and Medicare. So Medicare Original and Medicaid do not cover hearing aids, eye or dental. So they do not. But you can get a Medicare Advantage, which is a managed care part of the Medicare. And the plan, if you meet the conditions and criteria for the coverage, they'll cover it. I've been doing a lot of research and seeing a lot of states that are suing the Advantage plans or dropping the Advantage plans. New York Times came out with a scathing article about them making billions of dollars off of the Advantage plan. I have talked with Stephen Lung from SHIP. He sent me some pretty good information. Actually, some of it I have quoted here. I don't have time to go over it all. So it's really hit or miss as to whether it's going to be covered or it's not going to be covered. I don't have a number. So I was asked how many people don't have hearing aids covered, other than those percentages I gave you. Rob could maybe shine a little bit light on that. Rob, you had some ideas about some bills that, that could be helpful from what you see. What were those?
First and foremost, I think, creating some consistency. I think that's one of the biggest things that we need to see here. Like you say, no matter who you talk to, they'll talk about coverages, but they're so wide and vast and whatever the case is. Yes, as you said, the over-the-counter stuff is coming, but overall, it's really just not. When it comes to hearing aids, everybody is different. We're all unique. Our hearing losses are different. Ear canals are like fingerprints. So there is a lot of stuff that goes into it to truly get a device where you're getting the benefit that you actually need. So that's really where the assessment comes from. So, and then also determining whether we're going to fit adults or adults and children. So to kind of double back to what you said, Rick, when you talk about people born with hearing loss, yes, it doesn't necessarily mean their parents have hearing issues, but as we age, it is a genetic component. So if your parents had hearing loss, then you're more susceptible to develop it as an older individual yourself. So we can't dismiss the genetics, just not necessarily congenital related. From there, we also need to determine, again, exclusions of things that are over the counter, because again, if we're going to implement a bill, I think it definitely needs to pertain to those prescriptive devices that are fit by professionals. And then obviously the bill should outline what is considered a professional and who has the ability to actually prescribe these devices and perform these assessments. Now, the state already has a Hawaii hearing aid dealer and fitter licensing platform. So obviously being consistent with that, people that are already licensed by the state have already proven competency. So these are things that, I don't think we necessarily need to change that so much. But again, if a bill is going to be introduced, then it should apply to those that possess that license, whether it's an audiologist, ear, nose, throat doctor, or hearing instrument specialists like myself. Now, again, FDA has requirements that if there's other things that go beyond hearing aids, then those people are referred to the appropriate doctors in that case anyway. But so again, coming up with a benefit that actually suits the issue. Most people come in with hearing aids, and to kind of bring it back to my day-to-day job, education is hugely important. Unfortunately, most of my patients are so focused on the cost that they're not necessarily listening to some of the other points that are more relevant, And so if folks could actually come in, just get treated, know that they're going to be taken care of, and not have to necessarily worry about how much it's going to cost them. Well, now instead of having 1 in 5 people with hearing loss that are actually fit with hearing devices, it'd be hard to believe that that wouldn't be more like 4 out of 5. You know, obviously vanity and other reasons we can't get people to do things they don't want to do, but more often than not, cost and accessibility. So back to your managed care programs and things like that, that's the other big issue, is they have limited to no providers available. And in all honesty, the managed care aspect, like you say, doesn't really give the providers any reason to want to participate either, which is why there's so few of them. Because basically we can't even cover cost of operations to be able to support these patients once we get them. You know, so we're basically, you know, working for free, which I understand that that's not necessarily the focal point, but that's really the biggest issue there.
So, you know what, and backing all the way up to the original bill that we were supporting, 16 states across the country have Medicaid support for hearing aids. Washington, where I moved from, is one of them. So we could also just go back to that as a possibility, and including the education. Yeah, Rob.
So Medicaid is not a no coverage. It's a pre-authorization type of thing. So HMSA integration and some of the others, there are benefits there. But again, it's you know, it's kind of a like it's pretty hard to get somebody approved for it. It's not impossible, but it's not a guarantee, that's for sure. But then also, like, so again, with the issue with Kaiser is just, again, accessibility. You're restricted to Kaiser only, you know. So this is the other thing that I would like to say, if we're going to try to enforce a bill, is that if people are going to offer it, then they can't necessarily put red tape restrictions on where people can go. We should be able to become credentialed as a provider. You know, and obviously if we meet whatever specifications that they have, then there's no reason that they should be able to turn us away, aside just simply because we don't have Kaiser in our name, you know.
Okay. Anything else, Rob, you'd like to add?
Well, I think moreover, probably questions that people are going to have or anything like that. I mean, I can talk about this stuff for hours and days, as you know.
I know you can.
So you already have your foot in the door with Senator Moriwaki working on this on the Senate side. What about the House side?
Yeah, so, you know, Representative Troy Hashimoto is the other, you know, half of the Kupuna caucus. So he's certainly been a part of the discussions. And yeah, I'm going to guess he would be supportive. So, and what we're also doing right now is I'm really vetting a lot of this through PABIA, because I'm with PABIA before we launch into something, and certainly the Legislative Kupuna Caucus. I think Rob, the team actually made a pretty good impact on the Legislative Kupuna Caucus. So now we just need to spin out what the bill needs to look like, or bills. And I see Helen, you have your hands up, or a hand. Oh,
Helen,
you're muted.
Taking care of seniors and seeing things like on the internet, free hearing aid or call for your hearing aid. And a lot of them think that it's free, but when they call, they find out it's really a government loan to purchase it. So in other words, if it sounds too good to be true, it is usually. And what happens is that a lot of them are skeptical because they feel that when they die, because in the small print, it says that the money will be attempted to retrieve, meaning if you have a home or if you have an estate of some sort, the government could put a lien and get the money. And so a lot of them with like free solar, free roofing, free modeling of your kitchen, free, you know, that's how it is impressed to the seniors. And we've had seniors that are naive and they sign up for all of that only to find out that it will be gathered somewhere. And usually it's when they die. And we have the siblings who are waiting to inherit the homes or whatever, find that they can't because they have to come up with the money or the payment of the back taxes and all the things. And most of them end up losing the property to the liens that the banks put on it because of these loans. So in other words, all this advertisement of sign up for your free hearing aid, or it's there for you, they're afraid. And like my mother with her Kaiser plan, she had bought, I think it was like a $3,000 hearing aid and paid for it. And then as age, and you say it's genetic, well, of course, if you live old, it's going to be old age. And that's a genetic thing. But hearing loss comes with old age. And when they found that her hearing, even with the hearing aids, was getting worse, then they proposed a $10,000 hearing aid that was offered through Kaiser. And it isn't Kaiser. They farm it out to, I guess, people like you. And so they go to these independent places. And I guess somewhere along the line, they want to trade in the $3,000 and they can't. And so all of a sudden they're faced with a new bill of $10,000 for what they think is going to improve their hearing. So a lot of them aren't taking advantage of the program, and they hear this through a lot of their seniors, that there's a lot more to that dangling of a carrot in front of them. And a lot of people, especially the seniors and their caregivers or their children that are watching them, are totally unaware. They just say, hey, mom, you know, you could get roofing. Hey, mom, you could get a hearing aid. Hey, mom, you could get this. And it doesn't work like that. So somewhere on the line, we have to get back to the consumer being able to afford hearing aids. And it probably starts at the legislations, because there's a monopoly. And the legislators are not open to reducing the costs of the hearing aids that should be, you know, what are we talking about? $3,000, $10,000 for a hearing aid device that you can pick up for $29.99 on the, TV, some of them. But this one's going to fit perfect to you. You know, let's get to where we can find something that is really affordable to the seniors. And that's what I have to comment on.
Okay. Yeah, I think we have to do something about hearing aids. Definitely. Rob, go ahead.
So one thing I just want to say to that is when to cost, it is kind of like any other product that we buy. There is basic and then there's advanced. And so now in your friend's situation, obviously I can't necessarily speak for anything that happened there. But when you are purchasing better hearing aids, if you're not hearing better, then obviously you're not getting your money worth. But for a difference in cost of that, you're definitely should be able to recognize an improvement in your ability, which is also something that now, again, back to like the over-the-counter side, these are all things that we can test. So verification of what you're actually hearing is very important. So if your provider is just asking, hey, how does that sound? Well, then we're not verifying anything. That's validating that it's subjectively comfortable, but we don't really know if it's fitting you. So again, that's the importance of coming to a professional where we can do those follow-up tests to make sure that the hearing aid is in fact doing its job. But so to like the managed care side of stuff, so there are some actual free hearing aids, quote unquote, that come with those programs, but it's all of the services that come after that are not included. So even if you get the device for free, over the course of 5 years, it's likely going to cost you $3,000 to $5,000 based on whatever ABC hearing people are charging for their service plans. So that's kind of another thing is again, with all this stuff, there's a lot of loose ends. And so education, back to that again, is I think first and foremost. So knowing what you're doing.
You're absolutely right. They do go back for fitting, for testing and all, but they also have the option of returning the device because they don't feel that it's worth it.
Correct, yeah.
Right, so let's take a pivot here. We're going through, if you will, the pillars of life. We've been through health, and now we're going to go into housing. Greg is going to start. I'll follow Greg. Doug, you'll follow me, okay? So Greg, go ahead, please.
Thank you, Lila. And I'm going to be presenting some information regarding a proposal for a condominium ombudsman. And at some point, I'm just going to give you a summary. I've got a prepared written summary here, but at some point near the end, I'm going to ask Lila to kind of wrap it up and provide some additional information regarding a hui that she's actually a spearhead and leader of, that's hopefully going to help get this proposal passed in this next legislative session. So it has to do with the extremely high cost of housing right now that we are facing on the island of Oahu, and especially throughout the state of Hawaii. There's quite a number of condo owners that live in the state. So there's a very large percentage of our owners that actually live in housing that are condominiums or homeowners associations. Typically, they're referred to as AOAOs or AOUOs. And some of the reasons we are looking to get this proposal passed, and I'm just going to read from my prepared statement. The state legislature is aware that the laws they enact within HRS 514B, which, to define what that is, just so everybody is aware, HRS 514B are the statutes within Hawaii that are the laws that dictate how condominiums are to be run, the laws that are to be enforced. So the state legislature is aware that the laws that they enact within HRS 514B need to be enforced, and a lack of enforcement and accountability is negatively impacting homeowners and our kupuna throughout Hawaii. The current process to attempt to resolve condominium disputes or concerns regarding violations of Hawaii laws within HRS 514B is not working. The Department of Commerce and Consumer Affairs, the DCCA, their condo specialists, which are assigned to assist, do not provide any substantive assistance to help resolve concerns and complaints, and simply point homeowners to a specific statute, inform them that they can request mediation or that they will need to hire an attorney, as they cannot provide any opinions or legal advice. The Regulated Industry Complaints Office, RICO, which is the only enforcement office for complaints regarding condominiums, has limited areas that they will investigate and enforce. Not even, a small percentage of the statutes within HRS 514B are looked at by RICO. There's very specific ones, and then you also have to go and look at the real estate statutes for the broker who has the license. There is another avenue, which is mediation, and mediation, which many are advised to pursue, is subsidized by the DCCA Condominium Education Fund. That can be a very long, drawn-out process, often with very limited to no results. Associations typically hire attorneys and bring in their D&O insurance company attorneys. D&O is director and officer, which then results in the homeowners having to hire an attorney. When attorneys are profiting from the conflict and drawing out, the process for as long as they can, both mediation parties are experiencing the negative effects. Those negative effects are financial losses, time loss, emotional toll. There's impacts to the association, which are negative also. And also, if you're a homeowner there and you're trying to either sell your unit or even possibly rent it out, the impacts from increases in maintenance fees that could be the result of attorney's costs, if there's lawsuits, could negatively impact, your unit, your carry costs, or you trying to sell that condominium. So I'm not going to give you all of what I've written here at this time. It'll be presented at some future point, and I'm assuming everybody on this call today will have access to it. And what I do want to go to is that back in 2020, there was litigation that got to the level of the Hawaii Supreme Court, and rulings by the Hawaii Supreme Court in 2020 revealed just how bad the predatory practices of condominium associations and attorneys representing them had been. There were several court cases brought to media attention to shine a light, which revealed that many homeowners had lost their homes to unlawful non-judicial foreclosures. Evidence was supported that predatory actions were prevalent and improper fees and fines were piled on to punish homeowners for being late with payments or for raising concerns. The conclusion to this longstanding abuse of power was that there was clear and intentional malfeasance. Going back to 2017, there was legislation that was introduced that would have had the Attorney General's office oversee complaints for the condominium segment, where homeowners could actually go to the Attorney General's office and try to get a resolution there. Currently, that's not really an avenue. Homeowners do have the right to go to the Attorney General's office for anything, but they have the decision to whether or not to accept a complaint or defer it to a different agency. And currently, the DCCA is the agency that the deferral is to. RICO is the complaints office where you can actually file a formal or informal complaint. And there's more details that I'll be providing at some future time regarding what was done with the state legislature, but the bill that was proposed didn't really go anywhere. It was passed through to the referred to different office. I'm just trying to find it in my notes, but it was referred to a different office, the Legislative Reference Bureau. And I don't know what happened to it there. There's nothing else I could find as a follow-up. That was back in 2017, so it was quite a while ago. There's been nothing since that I'm aware of, and just want to get to the funding. But prior to the funding, I'll just mention there are currently 7 states within the United States that have an ombudsman office. These are typically the states that have prevalent problems with their associations. Their homeowners are filing many complaints to various offices within the state that, typically don't handle them very well. So these states are Colorado, Delaware, Florida, Illinois, Nevada, Virginia, and South Carolina. Florida, as many of you are aware, had just been recently in the news with the collapse of a condominium a year ago. And that state is very well aware of the need for the ombudsman. So they do have that office that's been put in place a number of years ago. For funding, which is basically how I'm going to conclude this, there's a very simple path for funding. Currently, the DCCA condominium specialist, the condominium education fund, and the mediation subsidy program are all funded by the contributions of every condominium homeowner in the state of Hawaii. The contributions are made during the biennial registration that most AOAOs and AOUOs make every 2 years. Currently, this contribution totals $5 per apartment and unit, which breaks down to only $2.50 a year for each condominium homeowner. And the proposal would be to expand that contribution to, I'm proposing just a rough number of $25 that needs to be looked at, and that's something the state legislature needs to address. But by bumping that up to $25, that would actually provide over $2 million annually to fund the condominium ombudsman office and the mediation subsidy program, and adjustments can be made to that depending on what's needed. I'm going to pass this over to Lila, and I apologize, I'm a little bit exhausted. I don't know if anybody noticed in the beginning, I had a little kitten that was in my lap. So we have a rescue kitten, and I have been not getting much sleep. So I prepared this in the last day or two, and I was going to try to just summarize and read it, but read it as I had written, but I'm a bit exhausted. I haven't gotten great sleep. So the little kitten's been keeping us up quite a bit. And I'm going to pass over to Lila to maybe summarize a little better what I just kind of gave us some detailed information.
All right, thank you very much, Greg. Actually, I can go on for hours about this, but I do want to keep within our time frame. First, what Greg pointed out, and I want to reiterate, is the kind of assistance that we're asking for the state to provide to create an ombudsman's office. However, it will not be coming from everyone's taxes. This is going to be self-funded by condominium owners. That's Greg's proposal. That's what I'm proposing and supporting also. Now, why are condominiums important in Hawaii? Because 1/3 of our residents own and or live in condominiums. And if you're going to be talking about affordable housing, you are not talking about single family dwellings. You are talking about homes built in greater density, most likely will be condominiumized. The laws that we have for condominiums have been written by developers and by attorneys and favor those parties. They do not favor consumers. According to condominium law, the way it's written, you are guilty before you can be found innocent. Okay, and that's something that we partially overturned a few years ago, but understand that that's how the government works. Condo governance works, excuse me. In condo governance, there is no checks and balances. The government you have is your condominium association board. They are the executive office, the legislative office, and the judiciary. So if something goes wrong and you happen to be in opposition to the board, where do you go? And that's why we're pushing for an ombudsman's office. We just went through an election. And thank you, Jillian, for joining us. I know that you were unsuccessful, but that's only unsuccessful in terms of being elected. In many of our eyes, you are highly successful, and we welcome your presence. The elections here in Hawaii have not been hotly contested. However, what you should know about condominium elections is that they're facilitated by groups, property management firms. Facilitators have an interest in the election results. So the elections are often not without interference or manipulation. Greg mentioned the collapse of the Champlain Tower South in Florida. A little bit over, well, that was in June of 2021, 98 people died. It was featured, it was one of the feature of last night's 60 Minutes program. They don't know why it happened, but part of the contributing force was that the association did not save enough money in its, did not build its reserve accounts strong enough so that it can provide building maintenance and upkeep. There are other factors that we're not aware of too, but that is just one of the contributing factors. The reserve accounts are suggested and maintained by our property management firms, and owners don't know enough about those funds to know if we are adequately saving for necessary improvements in the future. They don't know how those funds are created, how the monies are distributed. So one of my proposals is to create a database under the state for condominiums to upload their financial documents, any engineering reports or inspections, so that owners for those associations have access to these documents and can actually know what's going on. Kokua Council a few years ago brought the state to a suit. And part of the reason for that suit is that the state was uploading documents about the inspections of care homes. However, those documents are highly redacted, didn't serve the consumer. So we're asking for something similar. We're asking for upload of documents for transparency so we can have accountability. So other than the Ombudsman's office, the database, I'm also looking for some things where we can ensure that the elections are fair and honest elections. And we have a number of other measures that we would like to produce, promote. The property management firms that are supposed to guide and manage our association do not require that their staff be educated or licensed. So again, no accountability, no assurance of quality. And all of this piece plays into what we call affordable housing, aging in place. These are concerns of Kokua Council. Oh, I know. I'd like to do a screen share for one moment here. Hope I get to it correctly. There was an article the day before Halloween. I hope you can all see it. Mr. Yerton's office, what happens when lawyers for a condominium association try to collect their fees. I hope you will look this up. What happened was that an owner had a $150 fine, which ballooned to almost $50,000 because of attorney's fees. That's the kind of stuff we're trying to prevent. So there's just too much going on. Condominium law is too complex to pose here. But I hope that Kokua Council and our community affiliates will support our initiatives.
Lila,
Okay,
could I just interject one last thing? I think it's the
Sure.
important thing that, and I apologize for my not so great presentation. I literally feel like I haven't slept for weeks. We have the little kittens right to my right. So I'm alone today and my other half went out. So she's been running around while I've been on this Zoom. But the one thing that I think, and many of you may be able to relate to this if you live in a condominium, is that our maintenance fees and our insurance costs are skyrocketing. So that's the one thing I want to really focus on. In fact, they spoke about that in the 60 Minutes segment last night, where they said that basically the average retiree in Florida is being, pushed out of the market to live in a condominium. It's basically going to be very high scale, expensive luxury condominiums, and people won't be able to afford to live anymore. So that's going to be driving out a certain population out of various states. And it's happening in Hawaii right now. So just to give you the numbers, I purchased my condominium in 2019. And in 2018, our insurance cost for this building was about $118,000. Next year, it's going to over $500,000. So from 2018 to 2023, that's an unbelievable increase. I mean, it's unheard of. Our maintenance fees here where I live, I purchased in January of 2019, so far have increased over 35%, but now they're proposing to raise the fee as much as 21% next year. Right now, they've locked in 16.8, and they're trying to look at potentially going as high as 21%. These are the numbers and figures that are locking out people from potentially purchasing in the future that might maybe have an affordable housing opportunity, because they won't be able to afford the maintenance fee on top of their mortgage. The maintenance fee is going to be like a second mortgage, basically. But in addition to that, anybody who's trying to sell is going to have a problem selling their condos. And all of this has to do with deferred maintenance. And, there was deferred maintenance in the Champlain Towers that was proven. They're still investigating that. So that's going to be a while before that investigation concludes. But we have deferred maintenance where I live. And there were many things that weren't done in this building that should have been over the years. And unfortunately, that weren't. And now it's unfair that I should have to pay, and other owners who are just purchasing should have to pay for all of that deferred maintenance. And to the point where there's people now selling their condos because they can't afford to live here anymore. So I'll leave it there. I just wanted to give you some of the numbers and the shock factors. So, from 2019 to now, over 35% increase, and another up to 21% going into 2023. That's just a very short period of time.
Thank you very much. Dale, I see your hand up.
Yes, yeah, I'd like to mention that 2 words to keep in mind, okay? Never assume, all right? Never assume that the simple majority of the legislators are down there to represent their constituents. The other 2 words to keep in mind is dark money. No matter what your issue is over the years that our legislature, when they kill a bill, have a look at a website called followthemoney.org. Plug in the name of your legislators involved with that, and go and look at the testimony on your bill. It was killed. Like I did, you probably be able to match up names of people who spoke against that bill as being donors giving money to your legislator. It's out of sight. It's dreadfully dishonest. And I wrote a letter about this to our so-called leadership down there. Of course, crickets. Total silence. But if you'd like to copy the letter, let me know. I'll send it to you. Thank you. Bye.
Thank you, Dale. Jeff? Thank you. Go ahead, Jeff.
Yeah, I wanted to highlight a point that is probably of particular interest to senior citizens. That's the issue of fixed income, people who are on a fixed income, and how, you know, any type of increase in expenses is especially difficult for them to overcome. And Greg mentioned a lot about protections and resources that condo owners can go to if they have a disagreement with their condo association. But it's all very expensive. I'll just give an example of an elderly couple in my unit that ended up losing, or in my building, that ended up losing their apartment because of the fixed income situation. You know, they were an elderly couple. English was their second language, partially disabled, on a fixed income. And the association, the managing agent, the property manager, and the attorneys were each month charging them late fees in the amount of $1,500 a month, which is a lot for somebody who was on a fixed income. Now, at the same time, this couple was also paying their monthly maintenance fees, which in our building is about $500. So hopefully you can see the downward spiral that that situation creates. They're paying $500 a month for their monthly maintenance fees. They're also getting charged $1,500 a month. So they're just going backwards every single month. And the board did not step in to do anything. The property manager, which is the largest property manager in the state, did not step in to do anything. You know, they do the same thing to 100,000 people that they manage. The attorneys did not step in to say, like, look, these people are cooperating, you know, just work with them. You know, the elderly couple did not know the resources to go to get help. They did not even, you know, the only people they could go to was the board or the property manager, which, as Lila mentioned, there's no separation of powers. So they were arguing with the people who were acute, with the board, who was accusing them of doing something wrong. The board was just like, no, of course we're right and you're wrong. So anyways, eventually they lost their home. You know, they're 80 years old, disabled, out on the street. So just, you know, there needs to really be, I guess, a system where condo owners can get protection at an affordable cost without having, you know, $150 penalty balloon into a $50,000 of attorney fees, like what Lila showed. So just wanted to highlight that point of elderly people are on fixed income and they need some help, because right now there's nowhere for them to go for help.
Thank you very much, Jeff. I hope in the future that we can have a segment just on housing. Where is Doug? Doug, you're up next.
Okay, thanks for that was a presentation of people that may own condos. My issue are people that are renters, and that covers me, particularly seniors, which covers me also. This is a problem that comes up all the time, always mentioned, and always nothing happens about it. I think I know why, though, because it's kind of complex, and that is the issue of renters' protection, sometimes called rent control. Just as a summary, I mean, we all know in Hawaii, under the law, a landlord can more than double the rent, and then you have 40 days, 45 days to comply. And that's, of course, impossible for those with fixed incomes. And it's probably impossible for those with high incomes, too. If you're renting a house for $15,000 a month and it doubles, that's $30,000 a month. As an example, though, on June 1st, Hawaii News Now reported the story of a 77-year-old Maui resident, Robert Medeiros, who had been renting an apartment for 3 years for $975. He and his neighbors found a note pinned to his door that his rent was increasing to $1,927, double the rent. Second part of this is that under a recent Aloha United Way report in 2018, 42% of Hawaii families, 42%, were either living below the poverty line, that's 9% of them, or in a category whose acronym is ALICE, asset limited, income constrained, employed, working poor. And these 42% of people couldn't afford basic household necessities, with housing as the basic single cost. Now, one of the problems is that in Hawaii, rent and rent control, renters protections are handled under state law, particularly specifically Chapter 521 of the Hawaii Revised Statutes. It's very long, it's very complex. The landlord-tenant handbook, which digests and abbreviates everything itself, is 29 pages long. So what kinds of protections or solutions can be implemented? And those are things like limit rent increases or increase the notice time, require show cause for long-term renters. And these are all things that other municipalities or states have. And also in particular in Hawaii, require the military to provide safe housing for more of its members. And I'm not speaking about putting up Quonset houses on landfill, but good safe housing with clean water, and take them off the private market because they get a housing subsidy that increases the cost of housing for all of us. And it's within the military's budget to do that. Other places have all kinds of other measures in place. Oregon has a limit on percent rent can increase, and that is 7% plus the previous year's CPI. So that's obviously something we can consider. Also, most renters protections or rent control measures are by municipalities rather than statewide. So Berkeley, for instance, has some very powerful rent control measures. Let's see. A lot of places in the United States require a show cause hearing before terminating long-term renters. We don't have any of that, and a renter can be evicted for any reason, whatever. Other countries have rent protections. In Leipzig, Germany, the rent can't be 10% above the local comparable rent. And that was a measure that was pressed by Minister of Justice Katja Meyer, who's the Saxon State Minister of Justice and a Green Party member. And it was considered a break on rents that were spiraling too high. So the German government can act really quickly on stuff. For instance, when the price of gasoline hit $8 a gallon, they gave everybody in the country an opportunity to buy public transit tickets for $9 a month, €9 a month. And they have bus, tram, train that functions quite well. Also, New Zealand has limitations on foreigners buying land. We don't have any of that. The main problem, I think, and to get really to the point, I want to mention a couple of things actually, because Kokua Council has been interviewing candidates, and there were a lot of candidates that had an interest in some kind of rent protection measures. One is here today. State House candidate Jillian Anderson expressed an interest in that. State House candidate Kim Koko Iwamoto proposed a moratorium on luxury condos. Candidate for mayor Rick Blangiardi, who's now the mayor, said he was interested in exploring rent control measures. Council member Tyler Dos Santos Tam said he's interested in rent control measures, particularly for kupuna. Council member candidate Makua Rothman pointed out that we have kind of our own local version of rent control, and that's where the landlords voluntarily don't increase rent unreasonably on a family renting property. And that's certainly the case where I'm living now. I'm living in my landlady's house where she grew up when she was a kid, and she's older than I am. So we nightly pray for her continued good health. The problem, I think, is that in Hawaii, all the rent protections go through the state legislature. I think, like in many other places, they should go through the council. They should go through the municipalities. Municipalities, the consuls work year round. And so they can react very quickly to things. They can act on their own, depending on local conditions. For instance, all the sit-lie measures against people on the sidewalk were done through city councils. But how do we do that? I think we ought to ask the governor, the 4 mayors, and members of the councils what they think about this. It's kind of a hot potato issue. I don't think anyone wants the authority to do that. But once they do have the authority, I think they will have to act. So my proposal really is to make a very public request of the public officials named, governor, mayors, council members, about moving the authority for this. Now I see Lila has a question.
So Doug, have you worked on any kind of proposal? Have you brought it up to, your council member or to any of the legislators or councils members that you mentioned?
Without mentioning names, council members will say, that's handled by the state legislature, so you ought to ask them. And the state legislators generally consider it a hot potato issue because it runs afoul of a lot of interests of developers, labor unions, and that sort of thing. I don't mind cutting a deal with developers if they're developing, I'm against them developing shoreline resorts or luxury housing. If they're going to develop affordable rentals for people like Doug, we can work a deal. We can work a deal where you get the authority, where the councils get the authority to make rent control measures. If, there's also a connected development deal for unions and developers. I don't think you can do that too much out in the open, but I'm willing to do that out in the open too.
Well,
the traditional objections to it is it depresses the cost of housing. Now, according to Honolulu Board of Realtors, from 1985 to 2020, the average annual appreciation selling price of a house, even with the dips mixed in, was 4.7%, which is much greater than the rate of inflation. The median increase between 2020 and 2021 was 19.3%. The increase in the average price of a single family home between 2020 and 2021 was over 20%. So, it's a consideration if it affects the appreciation of housing, but I think that can stand some pressure on it. And plus, a lower cost of housing will allow more local families to own housing, even though I'm talking about renters here. I see Dawn has a question.
I guess I have a comment. I'm totally against having the landlord be punished that he left the rent low for 3 years and now can't ask for market rent. I understand that the government has made housing projects for low income that we subsidize, and we have Chapter 8 and everything, but to start telling every person that spends their life saving money to buy a house so they have rental income when they're old, and then say, oh, sorry, your renter doesn't want you to have any money, they want it, I think it's wrong.
I know your objection, but I still object to being able to double a person's rent on 45 days notice. I think that's objectionable. I think it's a reasonable objection. but we will agree to disagree on that. Any other questions?
I see Helen's hand is up. Helen, unmute yourself, please.
Years ago, when it was becoming that the marketplace was unaffordable to the younger adults, a lot of parents, seniors, were selling and downsizing their homes to be able to help the kids. Well, they moved into condominiums, or they downsized, not knowing, like we're in the predicament that we're in now, the increase of maintenance fees and all. So we started to investigate, and the authority comes from the consumer department. And we had senators go there on behalf of the seniors to want to look into a lot of these bylaws that are biased to the associations, like the legal matters you talk about, where it's the homeowner suing himself. I personally, serving on a board, saw a lot of abuse. A lot of attorneys were connected, and they're condo attorneys, with the legislators, with the judges, with the politicians. And you see where follow that money is. The donations that went to these senators was crazy. It was hidden even, thousands and thousands of dollars going for, quote, campaigns. And yet, when they started to look into saying the senators that were in favor of looking at these bylaws and talking with the consumer affair commissioner or whatever, all of a sudden they're released, they are promoted in a way that they're removed from their investigations. Senators were investigated and intimidated and left. The one in charge, the lawyers that were in charge, they got big. And now the latest one is the realtors have all these addresses of vacant properties that I heard were funneled to the voting, and all these ballots were mailed to those addresses that homeowners that would say, well, I went to go check my mailbox on my vacant property that has been vacant for 6 months, and I find all these dummy voting things that it's more or less like harvesting votes. There is so much going on that we don't know about, the normal public. And if you look at the arena, it's the realtors, the banks, the lawyers, the judges. And this is really what has to be exposed at this stage. Otherwise, there's, like you say, just last month, my husband said, you know, our homeowner's fee, maintenance fee has gone up $90. Just 3 months ago, it was less. I mean, we had an assessment. When we asked for the trees to be cut down because of the infestation of what trees bring, we were assessed as homeowners $8,000 a piece. And we asked, why didn't this come out of the general maintenance? And they said, no, because there's no money. There's no money is what's going on for all, and that's why we're having all these assessments. People are not being responsible with these monies, and it's all being covered up. I hate saying this, but there has to be a big push in people getting organized and approaching the senators, the legislators, the commissioners, and with consumer affairs, the RICO, because it's gotten out of hand. Thank you.
You know, thanks, Helen. Just to close up here, I mentioned also that Representative Takayama mentioned it's worth thinking about a law that incentivized putting all these vacant houses on the market for rentals. And that would reduce pressure on the prices also. Last thing I want to point out is any statute that gets passed or ordinance that's passed could be a delay period could be written in. In other words, this law, this ordinance would go into effect in a year or 2 years or whatever. And this gives the market some time to adjust gracefully rather than hitting anyone over the head with unexpected kind of change in circumstance. Anyway, that's all I have to say. Thanks for listening, everybody.
Thank you very much, Doug. You know, we have a commission to improve ethical standards, and I believe their next report comes out in December. We should be watching for that, because listening to some of you, your measures died unexpectedly. They went to some dark place and we never heard of those measures anymore. They were referred to the Legislative Reference Bureau. There's also things that happen, but these measures were unsuccessful and will continue to be unsuccessful if they're kept in the dark. So please keep an eye on what the commission is able to do for us. There are a lot of controversial issues that face a lot of opposition, and I think that we can be successful if we educate the legislators. Anyway, it's past 1 o'clock. Thank you very much, everyone, for participating, for informing, educating us about your measures. Please keep us apprised of those measures. We would like to know what the measure number is, House Bill, whatever, Senate Bill, whatever, so we can follow them. And it would really be helpful if you need support for your measure to keep us informed that this measure is up for hearing. This is what the measure says. This is what we'd like to see you do, support or oppose. And again, when it comes to measure, do not constantly just support that measure, because legislators often have a way of reversing the intent of that measure. And all of a sudden, the measure that you're supporting is a measure you need to oppose. Thank you very much for everyone's attention. It was good to see you, and we'll meet again in December. I'm going to end the meeting at this time. Mahalo na lilo. Take care.